Cause no one can do it like we do it, like we do it, like we do it. Cause no one can do it like we do it, like we do it, like we do it.
Hello, and welcome back to St. Jude in 5. Today, we will be highlighting Providence St. Jude's Pelvic Health Program, which brings together experts from more than 9 specialties to address all routine and very complex disorders, everything from incontinence to chronic pain. Today, I am here with Dr. Melanie Santos, our medical director for our Pelvic Health Program, to share some more information about our services. Thank you for being here today with me.
Thanks, Laura.
Oh, my goodness. This is very exciting topic, and certainly one that is continuing to evolve so rapidly. We know that 1 in 3 women will experience a pelvic disorder in their lifetime. Yet, unfortunately, we hear that so many women don't seek help. Why do you think that is?
That's a great question, and that is true. So 1 in 3, that's quite common, right? And so you'd be surprised to see that people don't want to address this. I think this is really for various reasons. One reason is, unfortunately, these things can be quite embarrassing. For instance, things like bowel control and urinary control. I mean, can you imagine? It can be quite embarrassing and very difficult for people to talk about, so much less to talk about it with their family and friends and their doctor. You know, it's very difficult for them to do. And so we've even noticed with things like fecal incontinence, as little as 15% of people seek treatment, and they just struggle with it instead. There's another thing, though, that can also be an issue for women, and that's, we are the providers for our house, and we are the people who organize the household and take care and manage things most of the time. And very often, I'm sure you agree with me with this, we kind of put ourselves in the background. Yeah. We want to take care of our spouse, we want to take care of our kids, our family members, and we always put ourselves a little behind and wait for that to happen later. I remember I had a patient come see me, and she said, my kids are gone now. My husband had a surgery. I took care of him. He's better now. Now it's my turn. And I told her, you should really market that. It's my turn. In fact, we found in studies women with urinary incontinence wait about 7 years on average to seek treatment. So we just wait for different reasons, and hopefully what we're bringing together with our program will help women to realize we have so many things to offer. They don't need to wait. They don't need to be embarrassed to talk about it. We're here to help them.
And that's why one reason of many why I am happy that we can have this conversation today, because for those reasons that you stated, it is an area where many don't want to seek help or are embarrassed. And we know that a lot of the work that you do not only supports women, but it also supports males as well. Can you tell us a little bit about how we are working with a variety of our specialists to support pelvic disorders?
Yes, we are definitely, the pelvis is an interesting area. And for instance, in the pelvis, you have, for women, your gynecological organs, you have your urological bladder issues, as well as bowel. So there's a lot of things going on there. And so one thing I'm so excited about with our pelvic health program is we are really bringing together a multitude of subspecialists together to work together to help the patient to deal with all of these things, because it's really difficult at times for just one person to take care of all of it. We're in this age today where medicine has changed and technology has changed. It's advanced so much. We have so many subspecialists, as you know. And that's so that we can really provide the best care in a focused area. But the patients sometimes struggle with this. I've had patients come to me who say, I have this problem you're taking care of, but can you take care of this thing too? And I have to tell them it's not really in my specialty, but I've got this doctor that we can work with for that. And so that is especially for our older patients who are used to the general doctor who might have even gone to their home at one point in time, but really took care of everything, even maybe help them deliver their kids, take care of their general medical concerns. And they get frustrated when we have to send them to 10 different doctors to take care of all the different parts of their body. But at least here in the pelvic area, with this program, we're going to be able to meld that, have these special subspecialists who can really take care of things in an excellent manner, but work together so the patient doesn't feel like they're just out on their own trying to take care of every little thing together, but we're there to help them to take care of it all together at once.
And that's just something that's wonderful to hear, because we understand how complex healthcare and all of these pieces are. But what I have observed and heard this team do so well is really ease our patients' way and help with that navigation of who is the best specialist to be meeting their needs. And that's just wonderful to hear. Urogynecology, we know, is a relatively new field, and we are fortunate to have two physicians, you and Dr. Bean, who are both board certified in this specialty. We talked about a lot of the areas that you guys are focusing with other specialists as well. Are there any others that you see potentially on the horizon that we are beginning to delve into the area?
In what sense?
In the sense of being comprehensive. I acknowledge, and I'm so pleased that we are such a comprehensive pelvic program. I just wonder if there's anything that we're not doing yet that you'd like to see us looking towards in the future.
Well, I think, as you know, we've been working on developing this program for quite some time, and I think this program is going to be key. We are one of the few programs really in the nation who are so comprehensive.
Yes.
And I think by really getting these subspecialists together, having people work together, us meeting together to really work on patients in those complex situations as well, you can start to integrate our care even surgically and non-surgically to really just heighten the level and the quality of care patients can get. So even those complex patients that you may have had to send to some sort of specialty place can now in our community hospitals seek that excellent care you may have to go other places in the past.
It is really exciting, and we are, as you state, leading the industry in the program and how comprehensive it is. So that's wonderful. Switching gears just a little bit and just wanting to get to know you a little bit. If for some reason you decided I'm going to totally switch gears and I'm going to join a band, what band would you join? She didn't know that question was coming. Got to be fast.
I know. That's a hard one because I like so many different genres of music. And the funny thing is I don't know if you know that my daughter actually is learning electric guitar and playing.
No.
And I used to...
Maybe you're going to join her band.
Well, I used to play drums.
Okay.
And I played drums in a jazz band.
Okay.
But I think I would probably go, because she's gotten me back into the rock era. So maybe go back to a little Def Leppard, a little something like that. Get some rock going on with my daughter.
I love that. That's great. And then just one more, maybe just thinking about what's your favorite family tradition?
I think it's what we just had recently was Christmas time, just family being together. For as long as I can remember, my family, we're in different parts of the state and all busy with our lives, but we always every year get together at my parents' winter house just to be together and do the Christmas traditions together. Christmas is a very important holiday to us, both culturally and religiously as well. So it's with everything going on, no matter what we do, we get together that one time of the year, and that just really stays true to my heart, and hope it just continues.
Thank you for
simple
sharing
things,
that.
Right?
You know what? The simple things are always the most special. Thank you.
Of course.
Well, that concludes this episode of St. Jude in 5. Thank you for joining us today. I'm Laura Ramos. Until next time, St. Jude, stay strong.